Hello, hello, it's Kevin here. It's been a while since I made a video, but I had lots to do, so sorry for that. So, as usual, disclaimer, I don't have to say it again, fair use, teaching purposes, non-profit, etc. Okay, so we've got the criteria all ready to go, and we can use this, okay. And somebody sent me a letter to the group. So first things first, check for word count. That's just guidelines, tools, word count, 208. Okie doke, okay, it's not too bad. Just get rid of this. So, okay, let me put some changes on. Here, changes. Okay. Now, the person who sent me this didn't send me the case notes, I don't think, but I've seen them in any case, and as I keep saying, I shouldn't need the case notes. Really, everything in your letter should be clear. The purpose should be immediately apparent. The content should tell me everything that I basically need. And no irrelevant information, the genre, the style, and organisation. Again, that should tell me the complete story. So really, I shouldn't need any case notes. Then we've got the language features, etc. So let's have a peep. So, Dr. Waters, Mrs. Potter. So I'm a surgeon. Okay. Mrs. Potter, who signs with arthritis, and a right. So, for which, first things first, whose signs and symptoms are, for which a knee joint replacement might be required, for which I request your further evaluation. So, we don't really need, I'm writing to refer and then I request. We don't need that. Why don't you simply do your why don't you just do that? I'm writing to request your further evaluation of Miss Potter. Signs and symptoms are suggestive of worsening arthritis, for which a knee joint replacement might be required. Nice and simple, concise, to the point, and purpose is immediately apparent. Right, good so far. Regarding her medical history, diagnosed with arthritis 2008, could she's taking one pill. Okay, right, that's the meds, that's good. Right, when? I'm the surgeon, I want to know, when did this event occur? When did Mrs. Potter present? So, on some date, whenever, blah, 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 Mrs. Potter presented with a, now, complaint of pain over the last 12 months in the left knee. So, usually we put the time first. Presented with a 12-month history of pain in her left knee during walking or while walking. Okay, that's better. Okay, so put the date at first on whichever date it was. Because if you don't have a date, then having a date here is meaningless. I have no idea how long this second visit, if it is a second visit, is it the first visit? I have no idea, because you don't have a chronology or some reference to time. How do I know when this is occurring? So, on some random date, Mrs. Potter presented 12-month history of pain in the left knee while walking. Reported recently the pain became severe. So, she reported that recently the pain had become, because we've got the simple past. So, we need past perfect, had become severe, or possibly more severe even at rest, and that taking Panadol Osteo was ineffective. Okay, so again, because I have no idea when this was, is this the same date? Is this a single visit? I mean, I think I remember from the case notes. Again, I keep saying, I have all these notes, right? And I'm familiar with them all. And I think this is a second visit. I'm not sure. But again, as I keep saying, I shouldn't have to keep checking. I shouldn't need to. If you've done your job, right? If your letter is effective, then all the information that I need should be here. I shouldn't have to be looking at the case notes. I shouldn't have to be asking questions. I shouldn't have to be thinking, who, where, what, why, how, when. I shouldn't have to, because you should be telling me the purpose is this, I want you to do this. And then what you are doing then is you're constructing a narrative, a logical story, a chronology. Right? You're telling me essentially a story, as I keep saying. And if you look at other teachers, their videos, that's what you're doing. You're constructing a narrative. You're telling me a story. Dear Dr. Kev, I want you to do this. To which I obviously ask, why? And you say, well, because this happened, and this happened, and this happened. And there was a visit, and she did this, and I did that, and she came back. In view of all this, restate purpose, I would appreciate it if you could, often at the end, do what I first asked you to do. So that's it. That's what you're doing. So again, as I keep saying to my students every day, if I've got to ask questions, then it hasn't worked. If I've got to say, oh, but what does this mean? What does that mean? How, who, where, why, what, when, as I usually do every day, then it means that your writing is not effective. It's not doing what it should be doing. So, no swelling or injury were stated. Were stated by whom? Why is it passive? Who's going to be stating this? Were noted. So, is this supposed to be the second kind of visit? Represented, blah, 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 blah. No swelling or injury were noted. Why would it be stated? Because stated by whom? Noted or noticed, as in you took note of, you noticed as the examining doctor, the physician. So Mrs. Potter represented. Again, why did she come back? So, for that the fifth or sixth time, now I've got to say I've no idea what is going on. No idea. This letter doesn't tell me anything. So is this the same visit or what? No idea. However, a pain in both knee joints were reported, but more in the left. I think it's right now. I seem to remember from my notes that she came first, and so usually a visit, right? The patient comes and says, doctor, blah, 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 I've got such a terrible pain. You ask some questions, oh really, examine, and then you do something, you take action. You prescribe something, you tell her to rest, you give her some advice, you do something. So that's the 3 stages of a visit. Patient comes and says, oh doctor, you take a look, examine, then you do something. Either you give some advice or you give some prescription. So I'm not sure what actually happened here. What did you do? Did you do anything? So is this the second visit? I seem to remember from the case notes it is. So she came back. Now, I wouldn't have put that there. So what did the patient say first? All right, so the patient comes and says, I've still got this pain and now it's coming in the left. Or, sorry, in the right. Yeah, so she would say, so the first thing is the patient comes, the patient says, oh, doctor, I've still got this pain, but now it's in my right knee as well. And then on examination, you didn't find any swelling or injury, a decrease, blah, blah, blah. And then what did you do? You took action. You did something. Okay? So, you've got this, apparently examination came before she even told you what was going on. So the second she walks in, you start examining. You don't even wait for her to actually say, oh, doctor, the pain's in both knees now. So that, it doesn't make sense. On examination, signs of a decrease in range of movement, range of motion. Range of motion in her left knee due to the pain, comma, as well as tenderness along her joint. And then you've got in today's review. So is this a different one? So Mrs. Potter presented with worsening symptoms. You could say because they have got kind of worse because now it's in both knees. So, it's like, what happened after this visit? What did you do, if anything? Okay. Is this a separate one? Okay. So, Mrs. Potter represented complaining of worsening symptoms. The pain was now in both joints. On examination, put that there because this is what happened. Grouping like inflammations, when there was injury, there were signs of decrease, blah, 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 blah. Okay, what did you do? So is this a separate visit in today's review? You mean on today's review? The X-ray revealed the loss of joint space, osteophytes, severe osteoarthritis, and increased dose of analgesia. What analgesia? You haven't even told me what, because earlier, if this was 3 visits ago, you said Panadol was ineffective. So what analgesia are you talking about? What did you give her? So that's not clear at all. Further management, knee joint replacement if needed. Well, okay, that's the first time you mentioned that. Well, no, you mentioned it there. But what is going on here? Okay, we've got the purpose, right, we've got the purpose now. So, it's here, the content, right? Content. Key information, no important details. Content, key information, maybe some, right. So, let's have a look. Now, it's not missing or inaccurate, it's just I don't know what is going on. I've no idea about the visits, what happened. There's some information, but it doesn't really tell me, so when, how, what. So how many times did she come? What happened on each of the visits? What did you do? What action did you kind of take? If anything. So organization, are they logical? Are they sort of clear? Well, they're kind of not, because I've got no idea, mainly because there's missing information or content. I've no idea what is going on here. I've no idea. I've got more questions than this letter provides answers, essentially. Really, So the purpose is clear, but the content is certainly not. I'm not sure what is going on here. Again, if I've got to ask some questions, any questions, it's not working, is it? Creating strain. It's causing me, certainly, strain in reading this because I have no idea what is going on. So, not very good. Not very good, really, at all. So, what you've got to do, again, purpose, get that clear. That's good now. Okay, restate purpose. Okay, it's good. But, then, history, okay, that's not too bad. But for the rest of it, there's more questions than answers, right? I'm not sure what is going on. or indeed when it went on, right? So this is what you've got to keep in mind, right? You're telling a story to the reader. I don't have any notes. All I've got is this letter that you gave me, and that's it. So in those terms, this does not work. There's some grammar and some vocab, but mainly I'm just not clear as to what's happening. Okay? So I hope that helps.